research. We just need to start acting on it. Well, actually, that is what the London Poverty Research Centre intends to do. And how we take the approach is really, as Ross said, is we know what the national statistics are, and we can even maybe extrapolate down to the provincial, but beyond that, we actually then don't know what's happening in our community. More importantly, often the research is undertaken with individuals interested in it from an academic lens, interested in it from a policy lens, and really let's dream in big technicolor. What we're trying to say with this research is we want to engage, and it's one of the potential partnerships we're excited about King's, is really the opportunity to make a participatory research, living research, engaging with the people who are impacted by the poverty, by the policy decisions, and what really would make an impact for them in their living circumstances in our 3 priority areas. Our first priority area that we're looking at is around food security. And Jane spoke to the growing reliance on food banks as part of our response as a compassionate and caring community. And our kind of response related to this is, you know, how does a family on precarious work income, EI or social assistance, put wholesome food on the table in the face of these enormous cost pressures? How do we do it with dignity in a different way? How do we actually address the inaffordability of food and the impact of food deserts on communities? What do these families do in the face of government retreat from the social policy space, in the face of tax fatigue from citizens? And how do we have that conversation and actually do something different related to that? For mental health or for precarious employment, is this the new reality? So we've heard that there's not going to be this recovery. Is this really our new reality, or is this a temporary arrangement as the economy recovers? What is the community, social, and family impacts of income-earning adults working multiple part-time jobs with few benefits and job security? And if you think about the impact that we actually don't have a bridging system from people who want to move from social assistance to full-time employment without losing their benefits and the impact on the health and security of their family. If we as a city are committed to retaining our young people, is that really possible when much what we have to offer in terms of work is precarious? And how do we shift that conversation in our partnership and work with one of our members of Emerging Leaders is really challenging those questions. And for the impact of mental health and homelessness, what we actually do know is that getting a home and a secure home is the first step actually to being able to stabilize and support people with mental health, and yet they are among the highest proportion of individuals who are homeless. So are we content with these current patterns of dealing with our mentally fellow citizens? There's been many promising solutions that have been identified, including investments in supportive and social housing, but it's taking too long. And we know the impact from a cost recovery benefit of being able to keep somebody housed. And what are those barriers that are stopping people from getting access to mental health diagnosis and treatment? And really, what would make a difference in London? And for me, that's the important thing in my community. I want to know what's going to make a difference, and then how do we scale it elsewhere? So we believe that this localized approach to research, combined with research being taken elsewhere, being able to make it accessible, not sitting in some policy drawer, not sitting in some academic research journal, is what's going to make a difference and have an impact in people's lives. Next, I'd like to introduce our funder for this initiative, Martha Powell, who is the President and CEO of London Community Foundation.